So my name is Sean Ahrens, and I run a software project called Crohnology. And I'm a programmer, a software designer, and obviously a startup founder now. Took Crohnology through Rock Health, their first class, which is very helpful. Thank you, Hallie. And I'm a two-time Y Combinator alum as well. And Esther Dyson also helped get Crohnology, our company, off the ground. So thank you, Esther. So first of all, what is Crohnology? So Crohnology is my attempt to democratize the healthcare experience for patients with Crohn's disease and ulcerative colitis. So what I'm doing is I'm giving these patients tools to track their health, to contribute to research, and to open up the playbook of what treatments are working for other patients. Right now, there's over 4,000 patients with Crohn's and colitis in 66 different countries around the world that are using our software. It's web-based and mobile-based. And these are some of the team members of mine working on a brainstorm. We're currently being followed by 3 different documentary films. One of those is called In Our Own Hands, How Technology is Democratizing Medicine. And the reason that I'm doing this is because when I was 12 years old and I was visiting Paris with my family, I came down with what I thought was a travel bug, a travel flu. It turned out that it was not, and I got back to the United States with a diagnosis of Crohn's disease. And Crohn's is an autoimmune condition that affects the digestive tract, causes inflammation. It's incurable. Like 40 million other Americans that have incurable conditions, you have to deal with this every day. And so using Crohnology, I'm showing you some of the treatments that I've done during my course with this disease. And this is just a partial view. There's probably about 25 treatments that I've done, different diets, therapies, DMSO, a BRAT diet, a SCD diet, fasting, prednisone, Asacol, Remicade, 6MP, acupuncture, suction cup therapy, like pretty much everything under the sun I've tried. And I had to make every one of those decisions on my own with no analytics, right? It's just like, I'm going to look on some web forums, see what's going on. My doctor's going to say, hey, here are 3 treatment options. Which one do you want to do? But I wanted more data. And so what I discovered is what does it mean to have an incurable condition? To me, the first discovery that I had was that it means that you have to be an experimenter. It means that you have to learn what works for you, almost as a researcher would. And I realized my experience wasn't unique. I stumbled upon this 24-hour comic done by this British artist that basically validated that, man, this guy's going through the same stuff. He's trying all these different treatments. When I was at UC Berkeley, I went to a documentary film where experiences from 4 different patients were followed, of everyone trying anything under the sun they could to make the thing work. And this is me. So I decided to go crazy. This is me like back in my Berkeley hippie days and deciding to do pig whipworm therapy, right? So there's preliminary evidence that you could take parasitic worms and it would help rejigger your immune system. And this is a video. I don't have time to show it, but it's up somewhere that I can share it later. So what I learned is that every patient's experience is a series of experiments. And to me, what I learned from that insight is that there's a lot of data that we could be learning from. And so while I was doing that parasitic worm therapy, I actually built out this little Google spreadsheet that allowed me to track my bowel function, how much gut pain I was in, and I plotted it out over time. And it created this as a result. Because what I realized is, like, I'm going to do something really crazy that only like a dozen other people in the world had done. Like, I should at least leave a paper trail so people can know what happened to me, right? But then what I realized is that, like, I needed to get more patients to do this so we could kind of share some of this data. And so that's kind of the vision for Crohnology. It was like, look, we're in this era of moving from people becoming prosumers, right? Like, they're contributing back. And I think that should happen to health. And I think that really, now that, basically for the first time in history, patients are now walking around with all the computing power they need to be continually contributing their data towards research for their own cure. It's hugely empowering, right? And I think that fundamentally changes what it means to be a patient in this era. So Crohnology is this network that connects patients to researchers and patients to other patients, that creates data discoveries. We publish those data discoveries. Patients find those on the web and in medical journals and rejoin the community. So people fill out health profiles. Here's an example of one. They fill out research surveys, and we reward them and motivate them with karma. And that karma represents how much are you contributing towards research for your own cure. You can receive that knowledge and digest it. You can see other people that are leading the way and becoming co-authors on studies using our health tracking software. So we just have this iPhone app that's in alpha right now, and you join a health study about what experiment you want to learn about, and other patients join in with you, and we learn what's working. We just got like this message this morning. It was like, this website's blowing my mind right now. Seriously. I think they meant that positively, right? Yeah, so you can imagine the power of this for research. So right now, we're actually, it's basically, in my opinion, this is too valuable for patients not to happen, right? To not be able to empower, like why are we doing walks for the cure? Why aren't we like tracking for the cure? Why don't we enable the patients themselves to be participants, right? So it's too empowering, right, to not happen. And it's too valuable for research for this, to not be able to access the patients and learn from them directly. And so these are current partnerships that we have in the works right now. And it also enables us to be financially sustainable. We had our first month of profitability. We're a startup. I'm super excited. Yeah. And you can imagine, so there's this whole move towards personalized medicine, precision medicine. And a lot of the underlying components of that are genetic sequencing, microbiome sequencing, and understanding drug response. We're that third category here, right? And so you can imagine where the partnerships are possible. Lots of patients. I'm running out of time, so I got to just jam through some of this stuff. Like if you just look at, these are treatment lists. The N that we have, like for prednisone, we have nearly 2,000 patients on our site that have taken it. And if you ask a question gets routed to those people that can answer it. We're pulling back the covers on things that haven't been studied before, things that don't make enough money to get the clinical evidence that they need. They don't return $1 billion, right? So we're being able to say, hey, these diets are showing comparative effectiveness on our site. Same with like top 3 biologics for Crohn's and colitis. And then we have all these cool analytics around like how long people spend on these drugs and what they do next. And this is really just the beginning. So like right now, like in the world, there are 750 million people living with incurable conditions. About a half of that are autoimmune conditions. Another large portion of that are psychological conditions. And that basically means we have the potential to have 750 million experimenters. If you guys are fans of Clay Shirky, the cognitive surplus that we have at our disposal, we can give people tools to learn from them. And I think this is really about a new way of practicing medicine, of moving from execution mode to learning mode. And that's about empowering patients to help us learn. Cool, thank you so much.